My name is Dr. Clement Nzuka. Today I'm going to be looking at heart attack as a condition. How does it come about? I've been talking about it as an etiological agent of heart failure. But then I haven't delved deep into talking about heart attack itself. You know, there are three fuel pipes of the heart. Two on the left and one on the right. Let me start with the right one. On the right, we've got a right coronary artery. On the left, we've got a left anterior descending artery. On the left again, we've got a left circumflex because it wraps itself around the heart. And those are the three fuel pipes of the heart. They are the ones which carry the fuel for the energy that's needed by the heart. Those are the three. And these three are amazingly vulnerable to all the risk factors that you can be thinking about. Smoking, diabetes, hypertension. You know, all these, obesity, they are so very much vulnerable to these. The most important thing to learn, let me start with smoking, for instance. How would smoking result in a heart failure? But heart attack. Smoking has got chemicals in it, and these chemicals, they are deposited into blood, and they move around in circulation, and they get to these fuel pipes. When they are there, they trigger factors which damage the wall of the circumflex artery. They damage the wall of the left anterior descending artery. They damage the wall of the right coronary artery. When they damage the wall, that damaged wall becomes now sticky. The fat material gets stuck onto this wall so easily. So the deposition of this it's so very much facilitated. The deposition of these fat materials onto the wall. And this happens year after year, year after year as you are smoking. You know, and it builds up what is known as an atheromatous plaque, and the condition being given a special name known as atherosclerosis because of these atheromatous flakes which are deposited on this. And they're so easily deposited because of one thing. You've got a wall that is actually sticky now. Because of what? It has been damaged by these factors which have been triggered off by the chemicals in the smoke. So this is the problem that we have. They get deep. Now, if you have to think of a person who's been smoking for 40 years, that person is not the same as a person who has been smoking for 10 years. So the damage, if we were to think of the damage that has happened or the damage that has occurred, it's not the same. So if a patient has been smoking for 40 years, smoking cigarettes, whatever, for 40 years, that patient has got a higher risk than the patient to get into a myocardial infarction or a heart attack than a patient who has got 10 years experience in smoking. The one who's not smoking at all is the one who's 10 years has got a higher risk of having these atheromatous plaques and therefore the atherosclerosis than a patient who is not smoking at all. Now, we have problems. It grows over time, and the patient is unaware of this. Nobody's aware. You just smoke. Nobody's aware that atheromatous plaques are busy building up. And when they are busy building up, one has to understand that the actual artery, its diameter is now narrowed. It becomes narrowed. They call it fairing up. It becomes narrowed. And so the effect of this is to narrow the blood vessel. The effect of accumulation of these atheromatous plaques. It closes up. But then you must think of a situation when you have a pipe. A pipe, at the end of the pipe, you put in there, you stick a chewing gum all around. So what you notice is that the diameter gets smaller and smaller. So the actual pipe, the area of the pulp where fluid is moving, is narrowed. And that's exactly what happens with an atheromatous plaque. When the artery develops an atheromatous plaque and therefore has atherosclerosis, it has got a narrowed area through which the blood is moving, a narrowed area. Now, if this patient were to develop another, maybe high blood pressure has got this one problem. We know that high blood pressure is characterized by constriction of the blood vessel. So now, yes, high blood pressure, the patient is having high blood pressure. Now, in addition to the fact that there was atheromatous plaques building up and narrowing the blood vessel, now we have constriction from high blood pressure. That's why it is so important to treat high blood pressure, because you don't know what is happening there. So the best is to treat high blood pressure so that you don't have this constriction. Constriction will give rise to clots, to clot formation, because you're busy closing, because and this pressure is on the blood vessel, on the blood itself. So Formation of a clot will be easy with the blood pressure. That's why it's important to treat the blood pressure. Because now, if it can close the end, right at the end, because the clot, when the clot has developed, it closes. So the blood will not be able to go through. It will not be able to get to the myocardium. And we're talking 3 fuel pipes here. We're talking anterior descending. Think of the anterior descending, which is right in front, and then the blood. There's a formation of a clot because of hypertension, which came with this vasoconstriction, constricting what? Constricting a blood vessel that is already having atheromatous plaques. In other words, whose diameter has been narrowed. The area where blood is flowing has been narrowed already. Now you're busy narrowing it the more by vasoconstriction. And this, if it's untreated, this vasoconstriction, the blood pressure is untreated, the patient is bound to have a what? To have a clot. And if there's a clot there, it will close the actual lumen of the blood vessel. And if it closes it, it means the circumflex, which I was boasting about, saying that, oh, this is the fuel pipe of the heart, it will be closed. So it means the areas which are supplied by the circumflex artery, left circumflex artery, will not get their blood. The part that is, the frontal portion of the heart, where the left anterior descending artery moves with all its branches, it will not be having blood because of the constriction. So a formation of a clot because of the constriction. The other thing is not only the blood pressure. Blood pressure, you remember when we were doing heart failure, we said blood pressure, once you have a high blood pressure, you are increasing the work of the heart. How can you increase the work of the heart when you are not supplying any blood? Remember, blood carries oxygen and nutrients. So these nutrients are not going to reach the blood, and then you're busy constricting it. In other words, the blood pressure is not treated at all. There's also another risk factor. Obesity, for instance. Obesity comes, obese patients, they normally have high blood pressure. You've got to check them out for high blood pressure. You've got to check them. High blood pressure is a problem. We know that it will end up having a constricted, will have a constricted arteries. So obesity is a problem as a risk factor, is a problem. But when you think of obesity, you also think of cholesterol. Cholesterol, when we think as a risk factor, cholesterol is one of those fats which are going to be deposited there, to make an atheromatous plaque. But then, when we look at cholesterol, we look at 2 types. We look at good cholesterol, which is HDL cholesterol. And there's LDL cholesterol, which we look at it as a bad cholesterol, because that's the cholesterol that gets stuck onto this sticky surface on the sticky surface or this damage to all of the of an artery. And these arteries that we're talking about as fuel pipes, like even the right coronary artery. So these fuel pipes cannot afford to have these plaques and cannot afford to have all these risks, to expose to these risk factors like hypertension. If they are exposed, please treat the hypertension. You can always treat hypertension. If you don't treat hypertension, you're calling for trouble. You're calling for vasoconstriction that will end up forming a clot. And clot says no blood. no blood to the areas which are supplied by the left circumflex, which are supplied by the left anterior descending artery, which are supplied by the right coronary artery. So those are problems that we have. In addition to that, there are other risk factors which contribute to this, like stress, for instance. A stressed patient. If a patient is stressed, what you are worried about is adrenaline that's going to be deposited onto the blood. The adrenaline and noradrenaline. Oh no, these, what do? They increase the heart rate, and number two, they increase the blood pressure. Remember, blood pressure, constriction, clot formation. We don't want that to already a damaged. You know, we are born with nice arteries, which are smooth inside, not damaged at all. But we start introducing all these funny factors. Diabetes, for instance. Diabetes, well, it's not you who introduced it, but if a patient has got diabetes, diabetes is one of the risk factors. People develop atherosclerosis because of diabetes and all that, because there's a constant inflammation that lies there all the time. So these patients, they develop atherosclerosis because of that. So atherosclerosis we just don't want it. We just don't want it because it narrows the what? It narrows the actual area, the lumen of the arteries. It narrows it, and we don't want that. So please, we need to understand that any stressful situation would promote the release of it will promote the release of epinephrine, not of adrenaline and noradrenaline. And those, when they are deposited, they actually cause a high blood pressure. And we know high blood pressure has got problems. They promote increased heart rate. And we know that an increase in the heart rate is just saying more work for the heart. And this heart is not a good heart, because this heart has had a myocardial infarction, has had a heart attack. So a heart attack causes a heart failure. So a failing heart, we don't want to increase the work of this heart. We don't want to increase it. So deposition of shall I say, adrenaline and noradrenaline because of a stressful situation. So stress is one of the risk factors. So we need to think about this as a risk factor. So we have to counsel the patient if the patient is concerned about certain things and they are disturbing the patient emotionally, and we need to talk about this. Also, physical inactivity. When a patient we regard it as a risk factor. Physical inactivity. The patient is not active at all, always sitting at one place and all. Physically, we want to encourage the patient to sort of exercise, and this is one of. So we look at a myocardial infarction or a heart attack as being caused by all these risk factors. Age, for instance. Age over time, there's a buildup of these atheromas over time. So age would be one of the risk factors. But if you have to think of age, as the patient is growing, we get patients who will be having a diabetes as a risk factor. We'll have a patient who will be having hypertension as a risk factor. We'll have a patient who will be stressed by certain things. Those are all risk factors which affect this patient. And what one has to understand is that those which are, physical activity, you can always encourage a patient to start exercising, to start just for physical activity. Patient who's obese, you can start counseling that patient to lose weight. It's a good idea to lose weight, and therefore the blood pressure as well. So the blood pressure must be controlled, patient must be on treatment. And I can tell you, if you do that, that patient will be safe from the vasoconstriction caused by 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 uh, by high blood pressure, and the vasoconstriction, which will result in clot formation, and the clot formation will result in no blood being delivered to the parts of the heart, like those which are supplied by the left circumflex artery, the underneath, you know, the undersurface of the heart, you know, the frontal portion of the heart with the left anterior descending. Those are the fuel pipes. We look at them as fuel pipes. They carry fuel. And we need to understand that they carry fuel. If fuel is not delivered, the seizure of the engine doesn't move, because the engine has got to have fuel to move. And if you suddenly cut the fuel supply, the engine stops. The engine stops. That's exactly what happens with with a myocardial infarction. A myocardial infarction, it's the cutting off of the fuel. It's the cutting off of blood supply. Cutting off because of an atheromatous plaque that is formed there. That clot that closes the blood vessel altogether, so that there's no delivery of of uh, of blood to the area that was supposed to be, supplied with this blood. This is where we are. We are talking about the development of of an obstruction. How is this obstruction taking place? Well, if a patient is smoking as a risk factor with all the chemicals in it, those chemicals deposited in blood, and in blood, they are the ones which move around the body and move around and get to these fuel pipes. And these fuel pipes are so very much vulnerable. They're so very vulnerable. They are the ones which now trigger factors which damage the wall. They trigger factors which damage the wall. And when the wall is damaged, it becomes sticky, so that facilitating the deposition of these fatty material. The fatty material gets stuck to this, forming what is known as an atheromatous plaque. And the atheromatous plaque, it builds over the years, without the patient being aware. This is when you should do your counseling as a healthcare worker. Make sure that you make your patient understand they build up over years. And if the patient develops hypertension, the importance of treating hypertension, because if you don't treat hypertension, there's going to be what? There's going to be now clot formation. And clot formation is what? Will give rise to what? It will give rise to a complete standstill now of the blood. The blood will not be able to reach the area it's supposed to reach. And this is where we are. This is the big problem. The heart failure came from the fact that there's no blood supply being given. Remember, the equation is always the demand and the supply equation. The demand must always be equal to the supply for everything to be normal. If the demand exceeds supply, problems. You can only think of problems. Well, with these patients, they develop what is known as an ischemic heart disease where blood, they get a pain, terrible pain, angina pectoris, and then angina pectoris, which goes on to become angina pectoris, as we said yesterday, that angina pectoris can be stable when it comes just once. Or it comes, that, and then, but when it comes, it goes away for a long time. But the frequency of an angina, it comes again and again, then that one is a stable angina. Also, the severity of it, it becomes more intense. Severity, that's actually a medical emergency. A medical emergency. So the patient has got to be admitted. It's not the type of patient that you can say, he's not my patient, for instance. I'm just a clinician. I'm there in the clinic. I'm there in the primary health care. So I can't be dealing with patients. Patients like that, I must refer them to hospital immediately because there's an impending MI, an impending heart attack, an impending heart attack when you have the frequency of angina being increased and the severity of it is important. How severe? If, for instance, if it was there for once in a while, and then it's there, it was once there, just there for 30 minutes, and then now it's there for 2 hours. So now the duration of it, tells you that this is now unstable angina, and the patient needs to be admitted. And this patient will have an impending, is actually having an impending heart attack. This is an impending heart attack. Patient will have a heart attack. Thank you very much. Thank you very much. As long as we understand now the heart attack, that heart attack comes about when there's a complete occlusion of the blood vessel. Complete occlusion of the blood vessel, such that there's no blood being delivered to the area that was envisaged to get this blood. It is not delivered at all because of and we know the factors which do that. You can make a difference. Treat that blood pressure so that there's no clot formation, there's no occlusion of the blood vessel. Thank you very much.